right, hi Ellen, my name is Emily. I'm going to be your occupational therapist today. Thank you for coming in today. How are you doing?
I'm doing okay.
Okay, and I understand that you've been having some arthritic pain. On a scale of 1 to 10, how would you rate that pain?
About a 5.
Okay, and that's in your right hand.
Correct.
A little bit more than your left?
Yes.
Okay. All right, awesome. So what we're going to do is we're going to roll you to the edge of the couch, and we're going to sit you up, stand you, and then put you in the chair. And then we're going to move on with the rest of today's session, okay?
Okay.
All right, so I'm going to have you, so you're going to lift your right leg up and bend your knee up. And I'm going to have you reach with this arm towards the end of the couch and go ahead and roll you over and I'll help you. And then you're going to keep your palm flat on the couch so that way you don't put any pressure on your wrist. And go ahead and push yourself up and swing your legs out. I'll go ahead and help you. Perfect. Feeling all right?
Mm-hmm.
Okay. So I'm gonna come put this gait belt on you. This is gonna just help me get a little bit of better support for you so I can help you when we're standing. And it may feel a little tight, but once you stand, it won't be so bad. Okay. All right, not too tight, right?
Yeah.
Okay, perfect. All right, so what I want you to do, so when we're rolling, so I'm gonna rock you over, nose over your toes 3 times. So 1, 2, and on the count of 3, you're gonna push up with your palms flat on the couch, not fisted like this. Make sure that your palms are flat, and then we're just gonna stand right up and stay there. We're not even gonna move. We're just gonna stand up, okay?
Okay.
All right. So go ahead and rock 1, 2, and then up 3. Feeling all right?
Yes.
Okay. And then we're gonna go ahead and shuffle right over to the chair, and then let me know when you feel the chair with the back of your legs.
Mm-hmm.
All right, go ahead and reach back with your palms open. Go ahead and sit it down. Feeling okay?
Yes.
Okay, awesome. And then we're gonna move on with the rest of our session. Okay, Ellen, so now what I wanna do is I just wanna get a little bit of a better idea of the range in your fingers, because that's mostly what's been affecting you. I know you've said you've had issues with buttoning and picking up coins and even baking cookies. And I'm gonna use this goniometer, and what we're gonna do is I'm just gonna put it over your fingers and ask you to bend as much as you can until you feel a little bit of pain. Okay?
Okay.
Yeah, lift your hands up. And go ahead and bend that finger. Okay, that's about 40 degrees, so it's a little bit lower than what I would like to see. All right, and then go ahead and bend this joint right there. That's about 45. Okay, and we're gonna do the same thing with your thumb. Go ahead and bend the outside joint. It's about 31. And then go ahead and bend the thumb as far as you can there. Yeah, so it's a little bit low. And so now that I've taken a little bit of your measurements, what I would normally do is I would want to give you some heat, and I would have you use a hot pack over both of your hands for about 10 to 15 minutes in order to aid with the pain management and help to loosen some of the muscles in your hand before we continue with the rest of the session. While Ellen is using the heat, I would want to continuously check her skin and make sure that there's no abnormalities and skin breakdown, blistering, swelling of the skin, and making sure that at the whole time that she's comfortable and that the temperature isn't too high. So now that we've simulated the heat, I just want to take the exact same measurements on your hands again and see if your range of motion has improved a little. Okay, so I want you to do the same thing that we did, and I want you to try and bend just the tip of your finger for me, okay? As far as you can. Good. A lot better. I got you up to 50 this time. I think you were at 40 last time, so we increased it by a little bit, about 10. And I'll go ahead and take your measurement there too. Go ahead and bend this knuckle for me as far as you can. Good. And that one we got you a little bit, 70, almost 75. And then go ahead and bend at this knuckle right there as far as you can. Almost 90. Very good. All right, and then we'll do the same thing with your thumb. So try and get just the first section of your thumb. Good, that's a little farther. Got you about 40 there. And then go ahead and do the same thing at this knuckle of your thumb. And as far as you can. Good, same thing, 40. Okay, so it looks like the heat definitely worked in loosening up your muscles. So now what we're gonna do is we're gonna do kind of just a little bit of an education activity. I know that you do like to bake cookies. So I'm just gonna give you a couple of strategies and methods that you could use to kind of decrease the joint inflammation and pain in your hands, okay? Tell me, when you are baking cookies, what tasks do you normally feel are the harder parts for you, that you feel the most pain when doing?
Usually it's mixing all the ingredients together, and then the actual rolling out the dough.
Yeah. Okay. Do you happen to have a mixer at home?
Yes, but it's usually packed away.
Packed away. Okay. So obviously, taking the least amount of pressure off of your hands is what we really want. So if baking cookies is something that you do quite often, one thing that you could do is keep it out and not packed away, so that way you don't have to continue to transport it. I know these can really be really heavy, so we want to decrease the amount of pressure that you're putting on your joints at all times. Using a hand mixer, over mixing it with your hands is a lot less work. So that's definitely something that you could do. Another thing, as we said with keeping your ingredients out, if they're all in one place and you're using a large kitchen space to do your baking, you can, instead of picking up your supplies and moving them to different parts, would be to, use your open hand and just slide them across the counter. We want you to be using your whole upper arm area as opposed to just your hands, because when you're carrying it like this, that puts a lot of pressure on not only your fingers but your wrists as well. We don't want you to continuously lose the range, and we don't want joint deterioration in the other parts of your arm.
Okay.
So I just want you to try moving the flour across the counter for me. And do you feel any pressure or pain when doing that at all?
No.
Okay, perfect.
This is easier.
Good. Another thing that you could do, option to, sit when you're doing most of your baking tasks, that will help increase your endurance and allow you to do more things with your hands. Another thing that you could do is, I have these gloves out here, which I don't really like these gloves per se, but ones that like cooks usually use. They're like kind of more plasticky, and they're definitely easier to get on. So using these on your hands whenever you're working with the cookies, I know sometimes the dough can get a bit sticky and tricky to kind of wash off your hands, so using gloves to keep, like I said, more pressure off of your joints, and so you don't have to bend your fingers as much when you're trying to wash the dough off. For the rolling, I know you said that was a huge difficulty that you mentioned. So as a lot of the other activities that we've done, with the transferring earlier is keeping your palms open so that way you're not bending your fingers. So I have a towel here just to simulate the dough. And then, so what you would do is really just try and use the base of your palm as much as possible, and use all that pressure from your palm. And you can go as slow as you need to. We're not running a race here, so
Right.
Just a slow movement, and if you feel pain, you stop. If you feel it kind of slipping out from underneath you, because it does roll around a lot, we could even, in the next session, we could work on building up the handle so that way it's easier for you to either grip or maybe make it even stickier so that way it doesn't roll out from underneath your hands. I want you to try rolling that out first. Good. And then just make sure that you're using more of the base of the palms of your hands. Good. How's that feel? Okay.
Good.
Do you feel the less pressure in your fingers?
Yes.
As opposed to gripping?
Yes, definitely.
Good. And like I said, we could even make these longer so that way your thumbs aren't getting caught in there.
Okay.
And then the last thing is using a cookie cutter. I know a lot of people tend to, grip them and push down into the dough to make sure that they get all the way through. And they'll kind of bend their arms like this, or their fingers. But instead, palm down and apply more force through your arm and your elbow as opposed to your hand.
Okay.
So really getting on top of it and kind of using your whole body weight as opposed to just the force in your hand, okay? So go ahead and try that. That feels okay?
Yep.
And then again, just make sure that when you're doing that, you can even use your other hand for support and, making sure that you're getting right over on top of that, okay? So with that, I think that we are all set. One thing that I would do after this intervention would be to have Ellen ice her hands in order to reduce any of the pain or inflammation that she would have accrued over the course of the intervention. So thank you for coming in today, Ellen.
Thank you.